Hi, and welcome to Candid with Cristina. Today we are going to be talking to Sondra, who is the author of The Girlfriend's Guide to Infertility. We're going to be taking a little dive into the subject of infertility and how it affects women's mental health and that of the family and support groups and all of the such. So with no further ado, welcome, Sondra.
Thanks for having me. I'm so excited to be here.
Absolutely, absolutely. So this is a really important topic to me because I talk to so many women who have gone through this, and you know, it's kind of like it's a 1 to 10, right? So depending upon how long they've been going through infertility, if they've had losses, what their support system is.
Yeah.
But you're unique in that in your dark time, you decided you were going to reshift the energy and be like, no, like you were going to go down fighting. So I'm really excited to talk about that. But I want to find out a little bit more kind of about your journey with this.
Sure.
So can you share your journey and your experience that you had with infertility issues?
I sure can. So my husband and I had been trying to conceive and kind of wanted to take a relaxed approach about it. We didn't want to be stressed out, which is ironic. We weren't like super serious about tracking or using any apps. But after a certain amount of time, I want to say it was a good 6 to 8 months, we were like, this isn't really how we expected this to go. And in the meanwhile, once I began, I was taking an oral birth control, and I had been on that since I was 15 years old.
So for you had the oral contraceptive likely is still in your system, right? They say, you know, the doctors say, I don't know that they really know.
Yeah, I don't think that
it stays in your system.
I don't think that they know. What I do know, just through my own self-advocacy of my health journey, is that birth control in general is very detrimental to your overall gut health and women's health in general, which is contrary to what you're told. Or I think there's more information available now that people are starting to understand the impacts of the long-term effects of this, which could be another conversation for another day. But you know, when back in the 90s, early 2000s, when it wasn't the 90s, I would have been way too young. It was in the early 2000s when a lot of teenage girls were getting put on birth control.
Yeah.
It was thought to be to help your overall women's health in terms of making your periods less painful or to help your skin. So fast forward to being married, going to college, I had been on it for about 15 plus years when I actually stopped taking it and didn't want to prohibit getting pregnant.
Yeah, I think you know what I often hear is that I did all of the responsible things. I didn't have a child too soon. I waited till I was married. I waited till I had a home, and I think it's the time that it takes and just the months going by that really take people by surprise.
Definitely.
Like, wait, like what?
Definitely. You're educated to think that it could happen so quickly, and you spend so much time of your young adult life worrying about not getting pregnant that you don't actually have a focus on what it actually takes to get pregnant. And
yeah, I don't think anybody's ever explained that can be a sport
exactly
in and of itself.
Exactly.
For sure.
So when I stopped taking the oral birth control, I had noticed some other things changing in my health, and I was a little bit focused on that, but in the back of my mind, and I think this definitely speaks to just trusting your gut and trusting yourself and being your own advocate in any part of your health journey, whether it be, you know, trying to conceive, or if you have other symptoms that happen, you know, postpartum journeys, or that could be a whole other conversation of things that you don't think about. But you know, in the back of my mind, I always felt maybe these things are related. Maybe some of the rapid weight gain and the changes in my skin are related to why we aren't having success getting pregnant. So I'll never forget, I had an OBGYN appointment, and I don't know if anyone watching or if you've ever experienced this, but you have a lot of anticipation building up to your annual appointment, or when you have an appointment with a specialist where you're like, I'm going to get answers today. This is going to be like, I feel so relieved that I have this appointment and I have all of these questions, and then, you know, when you get into the visit, the wind is quickly taken out of your sails. I had expressed, you know, the concerns like, hey, you know, I just stopped taking birth control. I had all of this weight gain. Like, do you think that these things are correlated? And the response I got from the practitioner was, well, I think the pill is wonderful. And have you ever considered isogenics for a meal replacement shake for your weight loss?
Oh, okay.
And I felt like I got such a punch in the gut. And it was that day that I said, you know, this is my life. This is my health. I'm going to do my own research and start to find out how I might be able to, you know, get some more answers outside of the women's healthcare that I had been getting for some time.
Yeah, because I think the irony is that women often think that they're going to go to these women practitioners and they're going to get this great level of support, and then they get there and they sometimes get vague answers at best, and you're like, wait, am I in the twilight zone right now? Like, isn't this what you do here?
Yeah. And I think, so one thing, when you go through infertility and you start to see the specialists, which are called reproductive endocrinologists, if anyone is looking for a doctor that specializes in fertility, you're not going to get that from your OBGYN care. It's actually a completely separate practice, and oftentimes they can be within the same hospital network. So I went through all of my OBGYN care was affiliated with Cristina Hospital in Delaware.
Okay.
And my reproductive endocrinologist was had an office within Cristina Hospital as well.
That's
so
fantastic.
They do have a great network and can refer you. The practice I was going to at the time just didn't offer it, and I think a lot of OBGYNs have the best practice of, well, you need to be waiting at least a year. So if you are not in that year time frame, but you feel like something's off, like, don't wait. Advocate for yourself.
Yeah.
Look up, research reproductive endocrinology within your insurance network, because a lot of insurance does cover fertility care in the state of New Jersey, and you can, you know, get yourself started. So back to my journey though. So I went to a new OBGYN that was opening in Delaware. This was before I even realized that I needed a reproductive endocrinologist, just to switch practices and get a new perspective.
Sure.
And I'll never forget this doctor. She is just a wonderful practitioner. And when I called to make the appointment, they didn't take my insurance, and I wanted to see her. Like, something in my gut just said, like, I need to keep this appointment, and she never ended up billing me because, for whatever reason, I don't know if it was a mistake or if it was divine intervention.
Sure.
But she was the one that said, I think you need to talk to a reproductive endocrinologist, and she gave me a ton of business cards. She wrote all these names down. Our entire visit was really just her helping me get to the next step, and that's how I found my practice of Reproductive Associates of Delaware.
Okay.
And I started seeing them. So all of this was from the year 2017 to 2018. So I didn't actually start working with a reproductive endocrinologist until 2018.
Now imagine if you had this whole time just kind of been going through the motions and not ever gone to see the specialist, right? Because that's what they do say. If it's not been XYZ amount of time, and sometimes they'll say, have you had any losses?
Yes.
Or if you've only lost one, is what they say, then that's really not a frequent loss. Like it's so
it's like belittling your experience.
Your whole and you feel very much you don't feel like a person through all of it, right? Like your emotional things are very much in the back burner of all of that. And so, like, that being said, what was your mental health looking like at this point?
At this point, you know, I was definitely frustrated, but the toll wasn't really there yet. It was just more of me like chugging along and trying to get to the next step and getting answers. So while I was frustrated, I wasn't anywhere close to being where I was when I was actually going through the process and talking to the reproductive endocrinologists.
Oh, yeah.
So one of the things, and one of the reasons why I was inspired to become an advocate and create resources for other women through my online community on Facebook and through this journal, was to help women feel more prepared and feel like they had some skin in the game or knew what questions to ask. The processes and testing that you go through, and I know that you have gone through this yourself, but if you don't know what to expect, it's very, very scary.
And it's not even that, but I know that I found they would throw these acronyms out.
Yes.
Or they would say, well, your level is XYZ. And I'm like, I don't even know what that is. I don't know. Is that important? Is that like, I don't, what is it supposed to be? Like,
it's funny that you mentioned that, because in the journal, I have a whole glossary of all different acronyms, and just other words that are used throughout the process of going through infertility care for that exact reason, because you're like, this is a whole other language. How am I supposed to
and you're just taking
this?
Notes, and you're in the office because they're just skimming, and you're like, okay,
right?
Like, oh, that's good. And they're smiling, so you're smiling, and you're like, I don't even know what this is they're talking about.
Yes.
So it's like it's all complete weird experience. Yeah. So the beginning part of it, we're not at like a 10, like
not
we're
at a 10.
Like we're like at a 1 or a 2. So tell me, what did your support systems look like as we're going into this? Because I don't know if people really understand why it's so necessary to have these in place.
Yeah. So to be honest, I definitely kept the early stages very private, as we were just kind of going through the motions, and at least up until the time that I found the reproductive endocrinology care team that I wanted to move forward with.
Yeah.
And I, I had a very small network of women that I knew that actually had gone through IVF themselves, which IVF is like the big process where you have your eggs retrieved and you stimulate your ovaries to produce as many eggs as possible. And then the actual in vitro fertilization takes place after the eggs are retrieved, because in vitro means outside of the body.
Right.
And that's when, so just because you have an egg retrieval doesn't mean that you have a viable embryo. The egg needs to be fertilized outside of the body. And that's truly the whole IVF
So
process.
It's like you're on this constant roller coaster of like, oh, you had 5 eggs. That's fantastic. And then like you wait for the phone call and it's like, oh,
exactly,
2 were good. And you're like, oh my God.
Okay. Exactly. So we didn't share what my husband and I just decided, let's just wait till we have more information before we bring anybody else in. And I'll never forget, after going through all the testing, which some of it was definitely, I'm not a medical person. I don't have a medical background, but being in the rooms and kind of seeing what was on the screens, I just knew that something wasn't right. Like, we talk about being educated in school, and you've seen the diagrams of, the fallopian tubes and what the uterus looks like. And I'll never forget, I had to get a process called an HCG, which is where they, you actually have to go through the oncology ward in the hospital.
Yeah, and they tell you, I remember this like yesterday. I remember the room was like it was very small, and I was like thinking, is this a closet? Like, are we in a maintenance closet at this point? And the first thing that the assistant said to me was, don't look at the tools. And I was like, what?
Why?
Why would you say that to me? I'm already kind of a little nervous about this.
Yeah.
Right. And it's the whole hype. Like, I don't know if you experience this, but like, oh, you can just take a mild pain reliever beforehand.
Yes.
You're like, wait, what am I going into right now?
Exactly. Yeah. And that's, again, like, I had no background of this. So that is something that's talked about a lot, the HCG in our group, because it has a reputation. And I remember looking at the images and just seeing the dye that they shoot into. I think it's iodine, and it just like went nowhere. And like, that's when I felt like I knew, like, okay, this is an answer.
Yeah.
But
it's never, it's I always say, it's nice to know that you're not crazy, but then when they tell you that there's really something wrong, that's when you're like, oh.
Right. It was definitely that moment. And I think at that point was when I started to have some of the like going into the dark place, as I call it, of like feeling like a failure, feeling like I'm not, designed to be a mom, or
for sure.
It's definitely disappointing. You also feel a sense of betrayal. Like, I never knew this about you, self. Like, you never told me that we couldn't do this. Like, if I can describe it the best, it was like a sense of betrayal almost.
Yeah.
That my body like betrayed me. And
I think it's frustrating too when you come from a large family and you're like, wait, why am I going through this? It doesn't. And when you're hyper responsible and you've done all the things, it's this really global smack in the face. So I definitely do remember that. But it's so frustrating when they hyped up that HCG so much, and then I don't know what your experience was when you left, and I was like, that was it. They messed with my head like that, and that was it. I was like,
well, I was definitely super emotional because I had like met this one nurse, and even though I knew that reproductive endocrinology was supposed to help me get pregnant, I still had these other health issues going on.
Right, so you had some co-occurring.
So when the nurse acknowledged everything I was going through, I just remember crying in the exam room, like, thank you. Like, I just remember saying thank you and like burst into tears, and she gave me a hug. And then I saw her again at that HCG. So I was just emotional, like thinking about that other conversation. So I remember her saying to me, it looks like you have some sort of tubal disease, but we'll let Dr. Neidhart tell you,
But
more.
I love that she told you, because how many times have you like been in these specialist office and like, they know something and they're looking at you. We're like, I know you know something.
And I think she knew on my face too, like I was like, this isn't right. Like it wasn't like it wasn't like you were getting like a lump or something looked at and like, there's a lump there, but like you don't know what it means. Right. It was definitely a blatantly obvious thing that like, okay, this is not.
So the win was, okay, there is a problem, which means that we can fix the problem, but then the lose is like, oh, there's a problem.
Exactly.
It is the worst. It is, that moment, that is the worst. So tell me, like, so when everybody kind of found out what was happening, like who was in your CBER circle? Who were your hype people?
So it was definitely close friends and immediate family, that wanted to be supportive. I would say that it was just for my personality. It was so great to have such a support system, but I also felt like I was letting everybody down because again, like I just felt like I'm supposed to be able to do this and I can't. So it was hard for me to share without getting frustrated because people didn't understand, or if they were trying to give words of encouragement, I was just like, I don't know if that's really what I need. So it was challenging to bring people in.
And it's funny, the irony of, the words of encouragement are usually, well, you should stress less.
Yeah.
Yes. I'm going to 27 appointments a month. just to make this happen, but I should totally stress less. Like there it is.
Yeah, I think that's another great point is this is a full-time job.
Yeah.
Because you have to, you do have to start tracking. You do have to pay attention to when you have to take your medicine. You have a ton of appointments to manage outside of your personal life and your job. That was one of the blessings of having Rad so close, as I worked in Delaware and it was right around the corner from where I worked. So I could just go either right before work or go out at lunch or get a quick blood test. But then you were taking the weight of whatever those appointments were with you in the workday. And that can be sometimes hard to compartmentalize. So
yeah. No, I mean, when they would call and they'd say, can you be here at 6 on Tuesday? Absolutely, I can.
And timing. Timing is always very important with all of this stuff. It's like, a certain time of day or certain number of hours. So that definitely adds to stress. So I think stress and then just being emotional is part of what contributes to the overall struggle with mental health when you're going through this process.
Okay. So that's great. So were there any specific coping strategies or techniques that you thought were effective in helping you through that?
So as part of my self-diagnosis journey, I was researching what impacts fertility. Okay. And a lot of what impacts fertility are environmental factors. So I went through the process of eliminating all my plastic containers and getting glassware. Okay. And I started swapping out all of my cleaning products with more plant-based and more natural cleaning solutions. And when in my research, I was learning that you can use essential oils. And then what I didn't realize is that essential oils can also help you with sleep, with emotional support. So that's where I started really getting into using essential oils. So it was helping me with my sleep. I would put certain oils on before appointments to help with just making me feel
just to keep you calm.
Exactly.
Yeah.
And then my husband and I had a ritual of saying the Serenity Prayer every single night, which flash forward to, going through the actual transfer process. And I met this woman who makes these beaded bracelets and she would post them on Instagram and she posted one with the Serenity Prayer on it. And I was like, I need that. So I wore that for really through all of my processes. So just little things that I felt were just God winks, kind of this, getting you through the next thing and leaning on that really got me through. And then it was after our first transfer, which was actually ended up being a chemical pregnancy. So that was really tough because you go through all of these steps and you're like, the one thing that is supposed to work didn't work. And I think that's what a lot of people don't realize is that IVF, IUI, whatever process you go through doesn't guarantee you a live birth. No. So I didn't realize that. I'm like, oh, you just do these things. And I think, I think unfortunately infertility is not acknowledged as much as a disease, which the World Health Organization recognizes it as such. But there are so many, you hear about Hollywood surrogates and people using IVF so they don't have to change their bodies. And
I mean, if you think just logistically, I don't know that they were taking postpartum depression very seriously for a number of years. And, unfortunately, a number of things had to happen.
Right.
Where women were either, discharged from the hospital at untimely times, and then they went home and they did horrible things to the kids
or themselves.
Yeah. And it's so I think
we need to go further in our rallying around just women in general. Absolutely agree. So I think because of the stigma that goes along with IVF, people are like, it's just gonna work, and myself included, because you don't really know it until you're in it.
Yeah, you don't know.
Yeah.
I mean, it's your first rodeo. Like, there's
Definitely.
and everybody's around you, and they seem so very straightforward about it. You're like, oh, I guess this is what we're doing. Okay.
Right.
So, yeah, I think you don't tap into that other group of people that have had the issues until after. It's almost like miscarriage when you lose. And then you talk to other people, and then you find your community. And then everybody's like, oh, I've had a miscarriage. And you're like, damn it, where were you people?
Yeah. Right.
Like, why is this happening?
And that's why I'm so passionate about sharing. And it was right after the unsuccessful. Well, so in my group, we kind of we try to find other ways of saying things didn't work out, like an incomplete transfer. Like, we try not to put negative connotation on it because it is really, really tough. Or some people will say failed transfer. It's like, we don't want to say a fail. Like, we try to encourage each other.
Right, but I think
it's hard.
There's enough self-talk, right?
Exactly.
That women have. Like, it is the loneliest place.
Absolutely.
Because I think at the core, and I can just speak for me, but I think at the core, I was like, what's wrong with me as a female that this is just not happening?
Exactly.
Like, what is going on?
Yeah.
And, I was in a place going through all of this, working in a female institution with women offenders who were coming in 8 months pregnant and drug addicted. And I was just like, what the hell is happening right now?
Right.
So just the unfairness.
Absolutely.
Right.
It definitely.
So yeah, so I get it. Like, the verbiage and all of that is just, you have to really guard it.
Definitely.
You have to totally guard it.
But I think when you're in those places of vulnerability, it opens you up to accepting something greater or something better. And I started to see online this promotion of something called National Infertility Awareness Week. And I was like, wait a second. Mm-hmm. What do you mean there's people talking about? What do you mean there's a whole week in April that people just share their stories and share their advocacy and try to educate others to lessen the stigma of infertility? And it was during that week that I was like, I'm going to share my story.
I love that.
And I'm going to start an online, it was like 2019, I think, when Facebook groups were starting to become really popular. So there were like groups that loved the same TV show, groups that were listening to podcasts. And I was like, I'm going to start a group. So I started this group, and I was telling the nurses about it in the office, and they put it in their patient resource
so something
brochure.
Very grassroots. Like, it's never even that you have to know how to do something, but do you know the people who know how to do something, who knows someone who might be interested, to really kind of blow it up in the way that you did.
And that's when we started the group, and I remember I was one of my other coping mechanisms was stress shopping, because I worked so close to the Cristina Mall.
Very good, tax free at that. Right?
There you go.
As a Jersey girl, that's what you say. Well, I saved $20 in taxes,
but I paid to go over the bridge and drive there. But it's fine. And I remember I was shopping in a store, and I saw this T-shirt, and it said Femmes, and I was like,
there it is.
That's the name. So I created the group, and it started out with about 12 people, and one of the group members was like, is anybody interested in doing an in-person meetup? And that thought hadn't even crossed my mind.
Love that.
And the girl that commented, we had a meetup at her home, and there was about 12 of us.
Okay.
And it was one of the most special days, like, ever in my life.
Yeah.
And we all still get together every year on the second Saturday of March, girls, if you're watching. And we get together with our babies that we call them freezer friends.
Oh.
So out of something, out of this hard process for all of us, we created this little family.
That's great.
Yeah.
That's fantastic. Your kids have a bunch of freezer friend cousins.
That's right.
That's awesome.
Yeah.
Oh, that's awesome. Do you feel like you received adequate support from your healthcare providers in your journey through?
I would say not until I found Brad. They're just it's just a very unique place where, the nurses are just, a lot of the staff has gone through infertility themselves.
Yeah. Well, you know what? I think I think, there is a connection to people's life experience and their passion, right?
Yeah.
And it can be a pivot. And I think for me, I know that until I had gone through it and until I had gone through postpartum, which was like, wait, what? I had to go through all this to have my babies. And now I have postpartum. Like, is this a damn joke?
Right. Yes.
When I was going through all of that, I realized I was a person who could serve as a vessel to make a difference.
Yeah.
And I'm all about service and all about helping. So I really was excited to find the right person to do the training and to work for. And Karen's great. She's, her training's amazing. And so I feel very blessed actually to work with people that are not just going through fertility, but also going through postpartum, and some of the parenting and the whole lot, because I'm able to take the passion and my issues. And so it makes perfect sense to me that the nurses, would they themselves have gone through it, because they know the right things to say.
Yes, they did. They did. And it was, so I would say, and they also had all these resources like they had that they put together that had the group. But I think I was just a little bit more of, again, choosing my own adventure, or, seeking out to find those areas of support. My group and the core girls that I just mentioned, really, really got me through it. Maybe we're trauma bonded in some way.
But you know what? I feel like we could put a whole nother shift on that, right? You were like preset into mama bear mode, because you were like, I don't like this. I don't like the stigma. I don't like all of this.
Yeah.
And so what we will do for our kids is, we would never do for ourselves. Mm-hmm. So what you were doing for your group, for your tribe, you would maybe not have, I can't turn around and get all upset about this right now.
Yeah.
Like, they're looking at me.
Yeah, definitely.
And you're standing in the front line. So go.
Yeah, that's a great way to think about it. Yeah. So I think, but I think like in general, I think it just depends on the practitioner. Like in my women's healthcare practice now, I think everyone I shouldn't say I think, I know that all of those doctors care deeply about their patients. I had 2 very difficult pregnancies and high risk deliveries, and the amount of care and just the doctors stopping in if they were in the hospital that day and knew I was there and checking to make sure I was okay. Yeah. Like that is an individual thing. It's not, dictated by a healthcare network or a hospital. That is truly the individual practitioner. So, and I think there are a lot that try to have resources. Like they will ask me, like, is there anyone you would recommend? Because you do get these surveys in postpartum of, how are you feeling? And I know I've reached out to you and let you know, hey, I gave your website to this practice.
But why do they give you the questionnaire actually, like right after you have a baby, about how are you feeling? Well, I'm high.
Yeah.
I feel like I'm still high, actually, to answer your questions. I'm not sad even a little bit. The timing. I feel like it's the timing.
And they only do it for a certain amount of time after postpartum. They're like, oh, you're fine.
Yeah, you're good. You're just scored XYZ.
Yeah.
And that's in some practices. But
right.
It's in other practices, you have these amazing practitioners.
Yeah.
Who are like, we're gonna wait for you to be home with that baby for a couple of months, and
exactly
3 hours of sleep, and how are you doing, and how's all that?
Exactly.
Yeah. So, but what are the lacking of resources do you think that there are in the healthcare system for women? Because you came up with this journal and it has all of the things. So I'm going to guess it's the holes that you saw. Using the acronyms as an example, using the charts as an example, because you're kind of in this world of, am I supposed to know all this?
Yeah. I think it's time, honestly. I think, time is money. Unfortunately, and to be able to sit and actually get into an in-depth conversation with someone and have time to answer all their questions, that is definitely one of the gaps. There's a new movement of concierge care, which is, out-of-pocket health care, but that's,
which I've seen. I haven't gone down the rabbit hole with that yet of even what that means. But being a person who takes insurance, I could certainly see where people would maybe want to take the avenue just in an effort to feel like a person.
Exactly.
Going through the medical field.
It's a very process oriented in and out, where I think with the groups and having the meetups and just feeling like you're heard, and also more individualized care, like even going through infertility, and it's like, okay, it's kind of like, this is our baseline IVF cycle prep, and then they tweak you a little bit based on how your individual body responds. But there's definitely an element of like, this is what works for most of the time, so we're going to start with that. But that's with all healthcare right now, so, or not right now, I should say, like, you know, traditionally, I guess.
Yeah, it's traditional medicine, I think, is it's changed. So what are kind of your hopes and expectations with the fertility journey? Like, what are you hoping for?
I hope just more compassion and understanding that it is a actual disease and diagnosis. There is data that shows that the trauma and emotional reaction to getting diagnosed with infertility is the same as getting diagnosed with a terminal illness.
Yeah.
And I will never forget the feeling that I had when my doctor said, for your best chance to have a family, you need to go through the IVF process. And I just felt like
most effective.
So defeated, so scared, so unsure what that meant. I also felt like a failure.
Yeah.
Because you think about, you know, you only hear about like people that, to your point, like people who've had so many losses that have to go through it. We didn't even have one success. We didn't even get to a pregnancy test. I've never taken a pregnancy test or seen a positive pregnancy test in my life, because I am a rule follower. So they tell you, don't test at home,
right?
Wait for your blood test. So I was like, nope, I'm not doing it. So I never have.
But you know, I think to add to your point of, you know, the trauma is, you know, I'm a big stories person, and I tell people that, you know, the issue that most of us have is that I would say that the majority of my clients are not sick. The majority of my clients are stuck.
Mm-hmm.
And a lot of times they're stuck on ego and story, because the story is, it wasn't supposed to happen this way.
Right. Yeah.
So when you're here in this place and you're like hearing these words be said to you, you're still in a reel on your head of like, why is this happening? Like,
yeah, definitely.
And I don't remember personally that anybody ever said to me going through it, you should go talk to someone about this.
Yeah.
Like, it was just like, and they could, you know, from a medicinal standpoint, they could handle it. But like, I was the person in my brain trying to fall asleep and understand what was happening.
Yeah.
And not one person in the office was like, you should go talk to this person, or this is the kind of person you want to talk to.
Right. And I think, we have a great friend in our infertility group. She does specialize in counseling for women with infertility and postpartum, but I wanted to find someone like that here, and I posted in the group, and I found you through my group, from someone that knows you. So I think just being more vocal and sharing that you have gone through, you have gotten some mental health support through the process, letting people know that it's normal, letting people know that there are practitioners that have a specialization in infertility and even later in postpartum, because you're definitely going to need it.
Which, you know, there actually is very much a hand in hand in that, because they say that people who suffer from anxiety, people who suffer from depression, certainly going through this journey, you have both.
Mm-hmm.
There is a higher percentage that you are going to suffer from postpartum depression, simply because, just like everything else, it's not going based on your story. And, you know, I think it's great, these books about what to expect when you're expecting, and until like nothing is what you're expecting. So then you come home and you're just like, how is motherhood supposed to be? And guess what? It's nothing like anybody ever tells you that it is. And that's perfectly normal, but you don't know that it's normal. And because you've already gone through the stigma, right? The stigma of infertility, you don't want to reach out to somebody else and be like, now I have postpartum. Because, oh my God, I remember saying to my mom, like, I feel like, and this was with my son, and I just adore him, but I remember looking at him and I looked at my mom and I said, oh my God, I think he just like came to just keep me upset. Like, I think he was born and he's just gonna, and my mom looked at me like I was completely lost. And she's like, first of all, no, he's a baby.
Yeah.
And he's not doing anything intentional. But I was just so sleep deprived and uneducated, and he put so much of my eggs in a basket of like getting through the pregnancy.
Yes.
That like being a mom was,
you don't even think about what to do with the baby.
About being a mom.
Yes.
And so of course now, like, you know, what you would do for your baby, but in that moment of like, dang it, can't I just get a break with my brain of just normalcy?
It's so true. It's the same thing. You spend so much time wanting to not get pregnant that you don't figure out how to get pregnant, and then you spend so much time trying to get pregnant that you don't think about being a mom. Like, it goes on and on and on.
Yeah, it's like this cycle. And then when I got the therapy for the postpartum, and then I had guilt. Then I had guilt of all the time that I wasted.
Yeah.
Of feeling like I wasn't a good mom to my son. It's endless.
Well, that's what I loved about you, because even with my daughter, like, I would be nursing her because we did telehealth and I could still be there with her. But yeah, it's tough. It's all tough. It's all hard. Yeah. Would I do it again to get my kids? No doubt about it.
Yeah. Yeah. And I feel like, you know, you had found out that you had your particular situation. I find out that I had to do needles in my stomach.
Yeah.
I'm deathly afraid of needles.
Yeah.
Like, it literally took me 2 hours in the bathroom with the first needle.
To prep yourself up. I can so relate to that.
I can't do this. But then I was just like, I had that mama bear that was in me. And I was just like, if I want this baby,
dig deep.
I gotta do this.
That's right.
So it is, you know, the strength that we have as women, I think is just never talked about. It's never talked about. But this is a hard one to go through.
Yeah, definitely.
So can you tell me, like, have you noticed any changes since having gone through this and now having your babies, and have you noticed any changes now in the person that you are?
Oh, absolutely. Yeah, I think when I look back, I was a shell of myself going through all of this, and even with postpartum, like I said, I had high risk pregnancies, traumatic deliveries. My daughter is 2, and I finally feel like I know, by fast. I finally feel like I'm back to being myself after 5 years of being a shell of who I was. Like, I remember calling you one time, or one of our appointments, and I was like, so I was watching something on TV, and it upset me so much that I had to call my husband, who was out, to come home.
Oh.
And just like little things like that you don't expect.
Yeah.
I think, you know, that's like kind of jarring and scary. You're like, what, this isn't me? Like,
oh yeah, the tears that come. Yeah, it's and you don't even know where to compartmentalize them.
Yeah.
Right. And you don't want to tell anybody. Like, that's the thing. I remember all the emotions that came right after having the kids for the first couple of years. I was like, I can't tell anybody that I have all these like weird after having children experiences, because you know what they're going to say? Well, this is what you wanted, and you went through all of this to have your baby. Which is,
that's a guilt. That's a whole thing.
That is the weirdest experience.
Yeah, it is. I had horrible morning sickness with both of my pregnancies, and it's like, you wanted this so bad, I can't complain.
So you can't say anything.
I'm not going to tell anyone how hard this is. But yeah, I think also too, just having, one of the positive things that came through this process was me having to realize that I can't control everything.
Yeah.
That I don't get to decide what happens in what order and when and what timing, and you know, I think that changed me for the better. because when you become a mom, you can't do that either.
Oh, please.
So it was like a prep course, I guess.
So what do they say? Like, God has a very good sense of humor. So
yeah.
you have a plan and he laughs.
That's right. Yeah.
So yeah.
Absolutely.
So I completely understand that. What role would you say that self-care would play in routine when you're going through this? Because I think not knowing what to do is often very stressful for women. So what are some things that, just in a self-care sense, like what could people do if they're going through this right now?
So I actually really leaned into yoga, because there's a lot of stop and start with physical activity with going through your egg retrieval, because you don't want to overstimulate yourself.
Right.
Then when you go through the transfers, you have like weight lifting limitations. So I lean to low impact exercise like yoga and having a focus on that, and giving myself something to look forward to, like taking the yoga class. Or my husband and I were huge outside going on walk people, and we really got into a routine with that when we were going through infertility. Like, I remember him on the first time we did it, like he just pulled me off the couch, didn't say anything, and like put my shoes on me like I was our toddlers now, and we just walked. And it's just finding these little moments of joy throughout your day, and trying not to make it be all about the process. Like I said, it is a full-time job.
Yeah.
You need to find something, whether that's exercise, movement. I think that's just good for mental health in general. I created a group, I created a journal. I also contributed to a co-author book sharing my story. So if you like painting or drawing or crocheting, knitting, cross stitch, anything, something that you can focus on and you kind of have something to show for it, I think is really helpful, because again, you go through all these processes and at the end of the day you might not get something. So it's just trying to find these moments of joy and positive things to put your energy into, because you can really just get sucked into.
And I think one of the things that you mentioned is really important, and I say this to people too, like nobody ever asks the dad or the partner.
That's a big one.
Nobody asks the partner, like, how are you feeling?
Yep, agreed.
When you're going through this and you're already upset with yourself and you're upset with the process, it's very easy to feel like energetically disconnected from your partner.
Definitely.
Which creates resentment, which creates a number of things. So it is absolutely necessary, I think, to be intentional about staying connected.
Yes,
because
100%.
Getting frustrated, getting depressed, and going through all of this, it's hard.
It is hard. You really put your in sickness and in health vows to the test going through infertility. I think it's also hard when I was the person that had the medical issue, but I can't imagine, I don't know what it's like to be the other person, and vice versa. So I think it's just always having that perspective and just knowing that, if you're the person, you feel less than. If it's your partner, they feel less than.
They feel like very left out. And I feel like, when the pregnancy becomes successful and when, you're feeling the baby move and all of the things, that is very much something that you're experiencing and they don't get to experience.
But they helped you, but they were part of the whole thing.
It's such a wild experience.
It is. I agree.
It's funny when the baby comes out and your partner sees the baby and the look of surprise on their face, and you're thinking like, what did you think was there? Like a watermelon, or like but you've had all this time.
Exactly.
And that is something that we never really think about.
It's so true.
And it is such a joyous thing after you've gone through the work and to have the baby. So I know.
Yeah, we should probably have the partners come in and give some advice.
Oh my gosh.
How to deal with it, or what they do. I do remember my husband saying, like, I don't know anybody else going through this. It's kind
Because, you know, if you think about this, like, if women aren't talking about this, I can assure you that men are not talking about this. Can you imagine?
We had this debate of, like, should we have a husband's meetup? And I was like, well, we can't force them to do it. They have to want to do it themselves. But we did do a poll at one point, like, would your partner be interested in a partners only meetup? So, you know, we try.
So yeah, so it's very bittersweet. It is a difficult journey. I would recommend anybody that's going through this, or if you have somebody who's going through this, to recommend that they go to talk to somebody.
Definitely.
You know, because what's often very hard is that they don't want to hurt your feelings, and they don't want to say to you, to the family members, to the partners, all of the things that they're feeling at the same time. That just creates more disconnect and more frustration.
I think that's very accurate.
And they just want to feel heard, and it's always better to be heard by somebody who's not at your Thanksgiving table. So
yeah, if you think about the emotions that you go through, like not wanting to go to baby showers for family members or friends when you're going through
and that's just it. When you're a part of a large, you know, family, and you know, you're getting the baby shower invitations, or like every single turn you're seeing people that are pregnant, or you have a friend that becomes pregnant and they don't want to tell you that they're pregnant, and it's like, it's such a weird place, and you don't want to be handled with those kid gloves like that. Like, you want to be included.
Yes, it is. It's a hard
deal
thing
with your issue. It's the weirdest space ever.
And then you have a sounding board when you have someone like yourself to talk to.
Yeah,
you aren't coming with all the feelings and knowing all the people and the ins and outs of the situation.
Yeah, no, people come into my space and they're just like, I don't really know what to start. I'm just like, throw all the dirt, throw all the stuff on the floor. We'll just pick up what we want to keep and discard what we don't, and we'll let it go. But absolutely, we're not gonna look at your pieces as though they're defective, because they're not. They're all part of your story. So if you're coming in and you're saying that this wasn't what my story was supposed to be, let's pivot and say that it was, and let's make it an amazing one. So I'm going to link some things into the comment section. One of them is going to be the Girlfriend's Guide to Infertility, for those of you that are going through this. If you would like to buy this for somebody who is maybe going through it, I think it's a great gift, very thoughtful gift. I will also link information for the Fearless Femmes group, so that you can feel like you're part of the community.
Yeah, great.
All right. Thank you for joining me.
Thank you.